Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Miss Raj. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamin Thomas from the Ministry of Governance.
Hi, I'm Bruna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment.
Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated.
I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take the vaccine. Need it.
Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. COVID-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
So we are in the community of Bells today. We are going for a list, making sure the community has a certain amount of people that get vaccinated. So we are raising awareness as well as education, as well as meeting the people, find out their concerns, why they want the vaccine, why they're not taking the vaccine, if they'll encourage their friends to take the vaccine. So all this is part of our vaccination rollout campaign. So stay tuned for more, and remember, vaccination helps. Get vaxxed today.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18, take the vaccine. To protect your family, take the vaccine. To safeguard the elderly, take the vaccine. To bring back with festivals, take the vaccine. Take the vaccine. Take the vaccine. Need it. Take the vaccine. Take the vaccine. Need it.
Good evening and welcome to this September 17th COVID-19 press briefing. This evening, our first presenter is Dr. Shaludin Ahmed, who is the national epidemiologist, and he will focus on the national statistics as it relates to COVID-19 on Ireland. Our second presenter, Dr. Adrian Deschaussets, who is the medical director at the COVID-19 Care Complex. To this evening, he will provide an overview of the COVID-19 Care Complex. So to get this briefing started, I would like to welcome our first presenter, Dr. Shaludin Ahmed.
Thank you, Ms. Orle. I recognize presence of Dr. Adrian Deschaussets, our medical director of the COVID-19 Care Complex. And to our listeners and our media, good evening. So first, I'll start with our COVID-19 status update for Dominica. This is as at September 16, 2021. Our total number of new cases, 50. 48 of them are antigen positive and 2 are PCR positive. Total active cases, 627. Total recovered cases, 2,173. Total COVID-associated deaths, 8. Total number of tests conducted, 64,841. Of them, 25,778 were PCR tests and 39,063 were rapid antigen tests. Thus far, 50% of our adult population took at least one dose of the vaccine, and 44.6% of the target population are now fully vaccinated. Let's look at the trends, daily trends, that is, since the beginning of this surge, July 28 to September 16. As you can see, the trends are a bit up and down. It starts high on Monday, and then as gradually days pass in the week, it goes down. So on that note, I put a weekly average on the line graph. As you can see that on September 13th, we had over 100 cases, about 117 cases. However, for rest of the week, the cases went down. So on average, we have about 57 cases per day. So this is down from 67 cases from previous week. Let's look at the number of active cases that we had at this time. As you notice, our severe cases, just about 6% of the cases are severe. Mild to moderate cases, about 8% of the cases, and then 81% of the cases are mild to asymptomatic. This is consistent with the global data that we have seen so far, pretty much along the line. Now, in terms of the proportion of vaccinated and unvaccinated cases, our total number of cases went up to 1,966 cases. Out of these 1,966 cases, 76% remain due to unvaccinated group, and only 24% were vaccinated. We have broken down this into 3 age groups: under 18 years, and then 18 to 35 years, young adults, 36 to 65 years, middle age group, and over 65 years, elderly population. The line graph represents the proportion of this age group in the population. So the under 18 years represents about 31% of the population, whereas 18 to 65 years group represents about 57%, whereas 65 represents about 11%. So if you notice that we have 18 to 65 years, actually majority representation of our population, and of them, over 70% are unvaccinated, are COVID positive. So the blue bar represents the unvaccinated population cases, whereas the orange color represents vaccinated group. So in summary, our daily average is 57 cases now, and weekly trend is somewhat at plateau. This surge is mainly due to our susceptible population. By that I meant unvaccinated population, 76%. And all 8 deaths, or 100%, were unvaccinated. So with this, I thank you for listening and your attention.
Thank you, Dr. Ahmed. Just to recap, Currently, as of today, there are 627 active COVID-19 cases on island, with 8 reported deaths. At this point, I want to welcome our second presenter, Dr. Deshuse.
Good evening, and thank you for the opportunity. Let me acknowledge my esteemed colleague, Dr. Shunaddin Hamid, our national epidemiologist, Ms. Oley, our moderator for this evening's activity, and the many Dominicans who may be tuned in here locally or abroad. Just to give a brief overview as it relates to the operations or the infrastructure of the COVID Complex Center in the northern part of the island in Picard, Portsmouth. The complex encompasses 8 buildings actually with varying bed capacities. There's the IUH, formerly the Ross University Hotel, the PBH, there's the Barron's Apartment, the Avisville Luxury Apartment. There's also the Avisville Comfort Apartment, the Regent's Hotel at TB, the CAC building, which has a capacity of approximately 108 beds, and the main facility, which is the St. James facility, where the more concerning of patients, when I say concerning of patients, the patients who are more critically ill would be admitted at that center. So patients who have been identified or captured throughout the respective catchment areas throughout the island as a result of the ongoing testing program island-wide, these patients, whether they are symptomatic, vaccinated or unvaccinated, as well as patients who are asymptomatic, unvaccinated, would be directed to the Northern Care Complex facility. So these are the prescribed or approved listings for the patients who have tested positive. A protocol has also been developed to ensure the smooth functioning and the efficient and optimum delivery of care for our patients at the COVID Unit Center. And this encompasses, again, the catchment of those cases identified throughout the testing program island-wide. They would culminate at the main triaging center, and that is at the RUH, where the designated staff or assigned staff would begin the process of triaging. In that process of triaging, patients would be directed or admitted or quarantined at the respective facilities dependent on the presenting clinical symptoms at that presenting time. So this brings me to the main facility, which is the St. James facility. The St. James facility has a capacity of approximately 60 patients. It has also been retrofitted with an ICU unit with a 4-bed capacity. There are 4 mechanical ventilators assigned. There are 6 CPAP machines assigned. So we are able to aggressively address some of the more concerning of symptoms of patients who are admitted at that facility. So patients whose symptoms are predominantly acute respiratory distress syndrome, we are able to address those patients, those conditions more efficiently at the St. James facility. Also to note that at present there are 474 patients admitted at the facility. 129 of those patients are symptomatic, and at the St. James facility, as we speak, there are 40 inpatients, and of those 40 inpatients, 27 of those patients are critically ill. More on the St. James facility. The St. James facility, besides the many resources that has been allocated to the facility, it is also staffed with a very competent staff. So there are 2 doctors who are highly trained in emergency care medicine and ICU trained as well. And these are Dr. Toro Brady and Dr. Rodriguez, one of our Cuban colleagues as well. They are also complemented by other doctors who are assigned to that facility, and I must mention the name because of the very good work that they are doing, the dedicated work they are doing, the commitment that they are shown. And these are Dr. Kieran Newton, Dr. Leblanc, Dr. Hernandez, and Dr. Jean-Jacques as well. We are able to do also at the St. James facility in-service X-rays. That's a very important complementary examination that is required for the monitoring of the evolution of those patients who are severely and critically ill at the St. James facility. And we are able to do those, averting the possibility of having to transfer so many patients down to the DCFH for such a service. And this has helped us tremendously in the management of those patients at the facility as well. We also do have a very strong laboratory support. And we get those from the RFA hospital, that's the Portsmouth Hospital, and we are strongly supported by the laboratory services of the DCFH as well. One consistent observation that is noted at the COVID care complex is the incessant number of admitted unvaccinated patients at the facility who quickly become aggressively and acutely ill and may require some level of advanced critical care. This in itself has posed quite a challenge for us because some of these patients lamentably have succumbed to the illness of their COVID infection. Now this is quite difficult for us as attending. It is even more so difficult to communicate such news to the families whose loved one has just succumbed to the illness. At times one feels that the spirit is somewhat amputated and there is no prosthesis for that really. So let me take this opportunity to extend on behalf of the Northern Care Complex facility, on behalf of the staff, our sincere condolences to the bereaved families who have lost their loved ones to the fight of COVID. But at the same token, let me take this opportunity as well to vehemently advocate the need for those of you who are not vaccinated or may not have considered inoculation to please get vaccinated. It works, it helps. It greatly decreases your chances of hospitalization. It greatly decreases the possibility of you developing the very severe form of the illness. It decreases certainly the possibility of you succumbing or you dying from the illness. It is one of the tools available. It is the main armament really for the fight against this COVID pandemic. So I urge you to take a more consistent, responsible approach towards your health, and please get vaccinated. We are stretched, we are overwhelmed, but the fight must go on. Yes, the fight must go on, and so we shall, and so we will, and so we must. It's our mandate to do so, and we will continue. But we implore you to just give us a little bit of help by making that step and getting vaccinated, so that we can curve or lessen the curve of this COVID pandemic. There is another observation as well, and that is among the young and the very young people, we are seeing a more aggressive trend of acute illness in such patients, and many of whom who may recover or may have recovered from the severe form of the illness are left with the sequelae of debilitating lung function. And this complete recovery of such patients are very much delayed and very much reserved. So I want to take this opportunity yet again to encourage our young people to avoid these cluster gatherings, respect, observe, and practice the healthcare guidelines and protocols that are established by the Ministry of Health. Practice the respiratory etiquette, wear your mask, use alcohol-based hand sanitizer, wash your hands as often as possible, as often as is necessary. But most importantly, if you're not vaccinated, if you haven't considered such, that you should. You should take that responsible, consistent approach towards your health. Your health is your responsibility, and you should get vaccinated. Please, get vaccinated. We are stretched, we are overwhelmed, let me reiterate. And there's a very thin line of being overrun by this pandemic. And the only armament really that we have is the vaccine. So please, give us a fighting chance. Give us a fighting chance as healthcare providers. I make that plea to you, please. In terms of other management strategies that has been developed at the COVID care complex, because there are many patients who are admitted at the facility who have associated comorbid conditions, we found it necessary to engage some of our colleagues at the DCFH because it was necessary to co-manage such patients, because we can't manage all the patients that require other inputs from different specialties on our own. So it was necessary to form a consultation forum, virtual consultation forum, and this forum is spearheaded by our esteemed colleague, Dr. Ferrara. Inclusive of that team is our pediatrician, Dr. Cassandra, Dr. Jacob, who recently had to travel to Portsmouth to perform an invasive procedure on a patient, and we are very grateful for his intervention on that patient that might have saved that patient's life. So we are very grateful to Doctor for that intervention. We also have on that team our cardiologist, Dr. Andrew. We also have Dr. Wu, our Chinese cardiologist, Dr. Lopez, our internist, Dr. Frederick, one of our general surgeons. So this cadre of specialists help in the co-management of our patients, because it is necessary to have their input, because these patients require additional specialized support, which, as one can tell, the specialized services are not fully decentralized at the COVID care complex. So we are grateful that we were able to set up such a virtual forum to have our colleagues participate in the co-management of our patients. We also want to thank the psychiatric team, who is led by Dr. Benjamin and Dr. Wallace, who recently, graciously, I might say, accepted our invitation to provide this much-needed psychosocial support for our staff initially, and we also extended that privilege to the patients as well, because we all know the importance of the psychosocial support. So we are grateful for the psychiatric team for leading the way in providing the psychosocial support for the staff and patient, and this has proven to be quite beneficial to all of us. We also want to extend our gratitude to the National Health Authority and the CEO of the DCFA, the Dominica China Friendship Hospital, Dr. James and Dr. Ruby Blanc, for ensuring that there is continuum of care of the patients who require other inputs, and this has proven to be very beneficial. So we are doing our fair share, despite the circumstances, besides the challenges, and any semblance of discrimination by any healthcare provider is on the onset arrested. I'm not saying that there is, but I will reiterate that our patients are given the utmost care and treated with the utmost dignity deserving of them. So before I end, I would like to urge all Dominicans who are tuned in, those of you who are vaccinated, please encourage those who are not, express upon them the benefit of being vaccinated. Those of you who are not vaccinated, I urge you to please get vaccinated. We as attending physicians have treated the patients who are not vaccinated, and the patients who are vaccinated, their numbers are not that many. They are always outnumbered by the unvaccinated patients, and the unvaccinated patients, I can tell you from experience, from practical experience, they do not do well. They do not do well. So please take that opportunity, adopt a consistent positive attitude towards your health. Your health is your responsibility. It's not ours, it's your responsibility. So give us an opportunity to have a fighting chance, and please get inoculated, get vaccinated. I am grateful for the platform, I'm grateful for your audience, and thank you very much, and I bid you good evening.
Thank you, Dr. Desjose, for such a detailed overview. This evening, I want to leave you with this short statement. We cannot stress enough the importance of following all the primary health and safety protocols. We cannot stress enough the importance of proper hand washing, sanitizing, social distancing, proper mask wearing, proper nutrition, hydration, and of course, vaccinations. With each of us doing our part, this is the only way that we can combat COVID-19. Thank you for joining us. Have a good evening.
Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Miss Roach. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Charmaine Thomas from the Ministry of Governance.
Hi, I'm Verna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment.
Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated.
I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine, take the vaccine.